Hello, and welcome to the Atopic Dermatitis 5-Minute Pearl series. This pearl will focus on the diagnosis of atopic dermatitis and superinfection. Atopic dermatitis, or more commonly referred to as eczema, is a clinical diagnosis. However, pruritus and appropriate morphology of the rash are required to make the diagnosis. Other features that support a diagnosis of atopic dermatitis include a personal or family history of allergies, asthma, or sensitive skin. The appearance of atopic dermatitis changes with chronicity. In the acute phase, there is increased edema in the epidermis, thus you may see more erythematous papules or sometimes even vesicles that may weep and become eroded. This is demonstrated in the photo on the top. As time goes on, you begin to see more dry, scaly eczematous plaques, such as in the photo of subacute atopic dermatitis, which is in the bottom left. And then finally, an example of chronic eczema can be seen on the bottom right. Here, the skin often becomes lichenified, meaning thickened and leathery, as well as dyspigmented. This is in response to chronic inflammation and scratching. Atopic dermatitis can be anywhere, and there is great variability in the distribution among patients. Most people think of the antecubital and popliteal fossa as the classic location for atopic dermatitis, and while these are very common locations in children and adults, infants more often have eczema on the face, torso, and the extensor extremities. The grading of severity of atopic dermatitis is very subjective. However, this table, taken from the Atopic Dermatitis Evidence-Based Care Guideline, shows a very rough representation of what most would call mild, moderate, and severe in both white skin and skin of color. In general, severity should be determined by both the clinical appearance of the rash and its impact on the quality of life for the patient. This table, created by the Children's Hospital of Philadelphia and included in the Dell Children's Evidence-Based Care Guideline, is a helpful reference for determining atopic dermatitis severity. In short, mild eczema often involves a very limited body surface area and is not overly bothersome to patients. In moderate eczema, there may be larger plaques with more excoriations, and the pruritus is starting to affect the patient's daily activities of living. Finally, in severe eczema, there is often more widespread involvement with very severe pruritus that greatly affects their day-to-day life and ability to function. We will now discuss the diagnosis of superinfection. The skin barrier in atopic dermatitis is compromised, thus increasing risk for infection. Bacterial superinfection is most often caused by staph or strep, and it often presents as honey-crusted erosions within areas of atopic dermatitis. You may also notice that the areas of atopic dermatitis are more red or warm than usual. Occasionally, the patients may be febrile. Though primarily a clinical diagnosis, bacterial culture of an open, wet erosion can be helpful to guide treatment. We will discuss treatment in another video. Though bacterial superinfection is much more common, patients with eczema can also have viral superinfection. Eczema herpeticum is caused by herpes virus infection within eczema plaques. Small, monomorphic vesicles can be seen. However, more often you will see small punched-out erosions once the vesicles have ruptured, either spontaneously or from the trauma of scratching. Eczema herpeticum is often secondarily impetiginized as well, as the open sores often become colonized with staph or strep. An HSV PCR swab done on a deroofed vesicle or the base of an open wet erosion is an important test for diagnostic clarification. Lastly, it is important to tell patients and families that the child should be considered infectious until all lesions have crusted over. This concludes the Atopic Dermatitis 5-Minute Pearl on diagnosis of AD and superinfection. We hope you found it useful. For more information, please reference the Atopic Dermatitis Evidence-Based Care Guideline from the Dell Children's Medical Center. The link is published below.